somewhere between death and taxes lies medical insurance. Ironically, they're kind of on the same continuum. Double ironically, today's story is about CEO Brian Thompson of UnitedHealthCare, who was shot and killed today. Let me introduce myself. My name is Dr. Dre. I'm a board-certified internist here in Las Vegas. Now, this story is like something straight out of Law and Order. Again, CEO Brian Thompson of UnitedHealthCare was shot and killed today, Wednesday, December 4th, while exiting a hotel in Manhattan. Supposedly, the assailant used a silencer. Yes, put a silencer on a gun, laid in wait for the CEO, and began shooting when he saw him. In fact, the gun actually jammed. The killer was able to clear the jam and then continue firing. What makes this story even more sensational is the suspect escaped on an electronic city bike. No, seriously, call Olivia Benson or Jack McCoy or somebody, because if this is not a plot from Law and Order, it's gonna be in a couple of weeks. Now, the motives behind the killing are unknown, but there is a lot of speculation. There's been some news that there was possible threats to the CEO's life prior to all of this, and it may have been related to coverage, medical coverage. But again, this is all speculation. Do I think this is medically related? Yes. Now, sadly, no one likes their insurance company. Even if you have the best of the best, you have the Cadillac plan, I've never heard somebody say they love their insurance. And when I first heard this story, I thought about the movie John Q.
What? I mean, you guys been taking money out of my check every week. I've been paying into this policy for years.
Right, and that's why we're going to cover you for the full 20.
You kidding me, right? I mean, come on.
Now, yes, I'm about to go on an insurance rant, but I do want to separate this specific tragedy from the general squabble I have with insurance companies as a physician. I get that we all have issues with insurance, but again, no one deserves to be gunned down and no one deserves to be shot. Now, the typical squabbles I have with insurance companies are pretty minor. Maybe I have a patient who has a knee injury, maybe they ruptured their tendon, maybe they ruptured a meniscus, and I know they need an MRI and the insurance doesn't want to pay for one, so they want me to get an x-ray and have this person do physical therapy, and I'm trying to convince them, listen, this guy needs an MRI and he needs to go to an orthopedic surgeon. That's the typical stuff that I deal with insurance, just being denied and trying to work around it. Now, I've had egregious stories. The worst insurance issue I have ever had was early when I started working after residency. It was totally egregious. I had a patient who had a colonoscopy. During the colonoscopy, they found an obstructive mass. So there was a mass blocking part of the large intestine. What do you think? Possibly cancer, likely cancer. So I get the report and I order a CT of the abdomen. Denied. The report says there was a blockage by a large mass. I order the CT of the abdomen again. Denied. I call up the gastroenterologist. Same thing. He's also trying to order a CT of the abdomen. Again, that was denied. So arguing with the insurance company, and no, it was not UnitedHealthCare. I don't think it was. But they were saying that the colonoscopy was a screening test. And since it wasn't diagnostic, saying we don't know what the mass is and we don't know it's cancer, ordering another image would be another screening. It wouldn't be diagnostic, even though we possibly think it's cancer. And after me and the gastroenterologist tried about 4 times, the patient just got frustrated and ended up paying out of pocket for this scan. Probably about $500 for a scan she didn't need and should have been done. Now, she did get the scan and she ended up with an oncologist and she's fine today. But these are typically what happens with insurance companies, and these are people's gripes. Now, again, back to this story about the CEO. I'm going to update you as soon as I find out what's going on. I'm sure it's going to be all over the news because things like this don't happen typically. But again, it's a wild story, but I think as physicians and patients, we should try to work with our insurance companies and just try the best workarounds so everyone gets the best healthcare. All right, thank you. Until next time.